What's up, you GATE trainers? Welcome to this week's episode of 3 PTs in a Pod. This week we talk about our favorite resources. We do another article review, and we finish up with the top 3 things we are going to buy with our first paycheck out of school. All right, guys, welcome back to another episode. This is our, I forget what number episode, but we've made it here. 4, 5? 4.
This is 4.
Yeah, this is episode 4.
Coming to you from the future.
Yes.
the past.
Dude, you
One
just
of
blew
them.
my mind
Sure.
right there.
So,
Well, technically it's spelled.
yeah, 4th episode. We're back. And it's sort of like people who, they start dating and then they celebrate like every month is like an anniversary. Yeah. It's like, all right, 2-month anniversary.
I can't believe we made it this far.
So yeah, we've made it. It's an anniversary, 4th anniversary for us on 3 PTs in a Pod. That is our name that we decided on. I don't know if that's ever been clearly stated.
I think we did clear that.
Finally,
Clear that up
third
last
episode.
week.
PTs
Even though we
in a
talked
pod.
about it in the second episode.
Yeah.
Or like the title was on it.
Yeah, a little bit shaky at times with certain things. We're not podcast
Consistency.
professionals yet, working our way there. But anyway, so this week, unless there's any other opening remarks or things on your guys' mind, we're going to get into resources that are our favorites. So favorite resources to learn from, mainly outside of the classroom and what we learn about in school. So.
And hopefully you are looking at resources outside of the classroom.
Yeah.
I think we covered that a little bit before, but we all think that's pretty important as far as development into a good clinician.
For sure.
Yeah.
For sure.
So.
Anything else before we get started? Anything on your guys' minds? Burning desires of things to talk about? Get off your chest? No?
I just had a thought, but maybe I'll save it.
Okay. Save
Keep
it
you
till
guys
then.
wondering.
Yeah, that's kind of,
PT related? Or?
Oh, yeah.
Okay. All right.
I'm still like thinking about it in my head, so
Still
maybe
formulating.
I might need your guys' help later.
Sure.
formulate
So we'll
more.
get to that before we finish. But so resources. What are you into? What do we look at? Why? Who?
Who,
All right.
what, when?
Region?
all right, I'll start.
Reproduction?
Reproduction. So, one of my biggest sources of learning is, and I think that goes across the board for all of us, is podcasts. Coincidentally, this is a podcast that somebody might be learning from too. So, so podcasts, not just PT, but like across the board, PT, strength conditioning, just general types. Like Joe Rogan kind of has a bunch of different
types of guests,
different people from different fields, and I just feel like it's like a super accessible way to learn, because if you're driving, you're on a commuter, like just walking somewhere, just doing whatever. Like sometimes I'll be making dinner, listening to podcasts, and you might not be absorbing like a ton of information, but like the volume of podcasts that I listen to, I feel like I get a lot out of it.
For sure.
And it's, again, like I said, it's really easy and convenient.
Yeah, especially with audio, I think even more so than books. Even if you aren't completely like in the zone or like dialed into what's being said, you do sort of absorb some of
it's
what's
like
being said.
Passive learning.
Yeah. So even if you're like, it's not a complete, waste of your time if you're not like completely listening. Like if you're cooking food or doing other stuff, like it is still worthwhile to have on, and you can always go back to it too, which is nice.
Yeah, definitely rewinding is a lot easier than having to reread something.
Right.
Oh, that's the best part. It's like the 15-second rewind.
Yeah.
Oh yeah,
Yeah.
perfect. Yeah. What podcasts? What are your favorite?
Keep us guessing.
All right, so I mean, we could all kind of go around and talk about our favorites. A few that I wrote down, Mike Reynolds' podcast comes out once a week. It's 15 minutes. I literally sit there and eat dinner on Wednesdays, and I watch it. Sometimes it's kind of outside of my scope. They talk about a lot of baseball, but it's also good to know just for the future.
I'm not a big baseball guy.
Yeah.
Dude.
And then
America's pastime? You're not
I think one of the things that attracts me to that podcast is kind of how they're very like practical with their information.
Mm-hmm.
They never say like you should never do this, you should never do that. It's kind of like, okay, like this might work in this situation, but sometimes might not be a good idea in this situation. and it's never like a black and white thing, which I appreciate that point of view.
Physical therapy never is. It
Yeah,
always
exactly.
depends.
And it's,
It always
I'm always
depends.
like thrown off by the people that are like, no, that you can't do this, no, you can't do that, unless
Yeah.
it's obviously like hurting the patient or something.
Right.
My favorite part is Lenny.
Lenny.
Lenny McCrean, dude, his
Okay.
accent is
His
phenomenal.
accent is
Now, my
sick.
favorite part is Dan Pope falling asleep. So,
And very student oriented too, I would say.
Yeah.
So especially for other people in
Really?
school,
yeah.
it's a lot. So basically, the setup of it is like, I guess, 3 questions every week,
Yeah.
and then they give their answers, and a lot of the questions come from students. So
Sort of like us.
Yeah, yeah.
Yeah, that's where we
Kinda
get all
like
our
us.
questions
Yeah.
from.
Yeah.
Next up, I have clinical athlete. So clinical athlete is a giant resource for any like sports or not even sports, but just like orthopedic oriented clinicians. So that is a company started by Quinn Hennick, who works for Juggernaut as well. So they have a forum and they do like courses and stuff. The forum is actually great too, but the podcast, it's Quinn and like 2 other guys. And again, they'll like review literature, and it's more kind of serious, but it's really informative. They talk about pain science and like tendinopathy literature and treatment, and it's like an hour long, so you get a lot out of it. But I'd say even more so, you get a lot more out of the forum.
Mm-hmm.
So it's like $7 a month to belong to the forum, and you can post, and that place will really challenge like all your biases. So like I know like I've read through like some of the threads and been like furious, like no, that's fucking
Yeah.
bullshit. Like I thought this and they're saying that that's not real. So like, and actually like a lot of the research that I do find and I do get is from there, because people will just post up research and discuss it.
That's cool.
That's I think a great resource, and same thing with the podcast. And then I have Zach Couples podcast, and that's just one dude that
What's his name?
Zach Couples. He again takes a very practical approach to PT. He talks about what works for him, what doesn't. He gives a lot of rationale for, and he explains things like anatomically. He'll even bring out like a pelvis model in the videos and like explain what he thinks is going on, like what's affecting what. And again, he'll answer like 3 questions, and he usually does them live too. So if you wanted to watch him live, you could chime in and ask a question, and he'll answer it right then and there.
Oh, cool.
He's actually answered some of my questions before, and overall it's good. It's actually pretty entertaining too, and it's like half an hour. And then PT Inquest is another one, and that is just a straight research review. They'll take an article. I think they release one like every week. They'll take an article and they'll talk about it, talk about like even the statistical analysis, and talk about how this is significant to clinical practice. And then I have like a few.
That's also a podcast.
Yeah,
Okay.
yeah, that's a podcast. And then I have a few strength and conditioning podcasts, which I think are pretty relevant if you're in an outpatient orthopedic setting to know how to train people.
Yeah.
Like those principles are kind of overlying with the rehab process. So physical preparation podcast with Mike Robertson, and then all things strength and wellness are 2 really good ones. Just all around good podcasts. Sorry, I know like I gave you guys a lot.
Yeah, no, it's all right. I'm writing everything down, and then we'll post like this somewhere, maybe in the description of the
Yeah,
YouTube
cool.
video, or put it on the screen somehow. Couple things, just so legal notepads, big thing if you want to come across as a veteran physical therapist. Legal
Close your eyes wide.
Little
notepads.
hockey trick.
Yeah. If you want to look like you belong, the legal notepad is key, as well as the pen. So if you want to zoom in on that pen there, a nice, firm, sturdy pen.
Zoom in. Zoom in.
If you want to look the part,
How
You
about
forgot one thing.
what?
Go in your back pocket.
Oh,
I was gonna go
almost
another
forgot
route.
that. Yeah.
I was gonna go leather over the shoulder satchel, not a backpack.
I kind of want.
Backpack-
I don't have one yet, and I don't think I'm ready
backpack
for
makes
one,
you
but I
look like
do
an
want one.
amateur.
Backpack
over
does
the
look
shoulder
like-
leather
yeah.
satchel where you
Yeah.
just pop that bad boy open, take out your 5 legal pads.
Yeah.
That's a veteran move.
All right. Yeah. So, you're not always going to know as much as the more seasoned veteran physical therapist that you work with, but you can at least look like
You
you
look
do.
the part,
Like,
yeah.
look the part.
Fake it till you make it.
I mean, honestly, patients see right through it. If you walk in with a fucking backpack,
Yeah.
dude, like,
Looking
who
like
is
a
this
scrub.
child?
It's your first day
that's
at work.
like- yeah. Who is this fucking kid about to touch my back? So that's that. But yeah, so those are all really good. I mean, I haven't even heard of some of them, so I appreciate
Big
that.
podcast guy.
Yeah,
Big
huge
podcast
podcast
guy.
guy over here. KP, any others that you like or?
See, I went the opposite route. I was never a really big podcast guy, to be
Okay.
honest.
Fair enough.
Until one of my buddies started his own from back home. It wasn't about PT. or
Don't talk
anything,
about other people's podcasts. don't promote your boys'
but
podcast.
You just promoted like 8
Yeah.
podcasts.
They're already established.
Direct competition.
And he doesn't even do it anymore. So that's what, like, how I got introduced to it, and then I started listening to Mike Reinhold. He was like the first one. I feel like that's everyone's.
Mm-hmm.
That was your first one. That was your
My first time.
Yeah.
Thanks,
Nice.
Mike. But now I find myself following a lot more people on Instagram. Huge
Okay.
Instagram guy.
Okay.
So it actually started with Mike Reinhold again. But I love how there's like this niche community on Instagram where everyone's like reposting each other's
Yeah.
things. So right now I'm probably following like 40 or 50 people. I don't even know all
So
the names.
what's the ratio of you following PT pages and chicks with fat asses?
Mm.
1 to
Like,
1, you would say?
Or
Or 2 to 1 chicks to PT?
2 to 1 PT to chicks.
PT guy. That's
Yeah.
a sure sign.
That was a trick question. Right?
That ratio. That
Am
ratio
I
tells
still in
you.
the program?
You're good, you're
Is this
good.
a test? So someone I know from town actually is a PT. His name is Nick Bonforte. I think
Shout out, Nick.
you actually know him
I
too.
follow him, so we're basically
You're basically
friends.
the same
Yeah.
thing. He posts a lot. He has a bunch of followers. I think like thousands, maybe like hundreds of thousands. I don't know.
I think it's like the 20,000.
Did I just like over exaggerate? But he'll like repost articles. He does a bunch of like article reviews, which I like. He'll like focus on like a impairment, and sort of talk about that. He'll like in the video he'll like put the structure in like this anatomical figure and like talk about it and like how it moves and like just his filming skills I think are like really show it well. And then he'll talk about what other people are doing in other articles. Then I kind of follow just like a bunch of medical like Instagram accounts. Medical Talk is like the coolest account. I think it's not just PT. It's actually like not PT
Is that the
at
one
all.
where they show like surgeries and
Yeah,
stuff?
it is
That's
so
cool.
cool though. Like it's kind of like strange things that could happen and like what doctors have done to fix it. And even though it's not really in our scope of practice, it's fun to learn that way.
Sure.
To see something new and interesting. But yeah, like I said, I follow too many. I could probably pull some up right now, but
That one was called Medical
Talk.
Talk. And
That
that's
is-
an Instagram account.
Yeah.
Yeah, and I think like off that point that you were just saying, KP, I think it is important to follow people outside of physical therapy as well. Artem, you mentioned strength and conditioning. That's a huge area of people and places and resources to look into. I think we talked about it just this past weekend, how so few physical therapists have like a good grasp on strength and conditioning and how to being able to properly teach exercises and movement patterns and things like that. And you're not going to learn that in school. Unless we're about to get hit hard in our third year with squat, deadlift, motor, different movement pattern techniques, hip hinges. You're not going to see any of that in school. And if you don't have good instructors who know that stuff out in the clinic, you're not going to get it. So if you can't teach exercises to patients, you're missing out on a huge area, I think, of treatment. So that's another area. I think also just, again, KP, like medical professionals, nutrition, even like psychology, all different, what is the word I'm looking for, disciplines that somehow tie into PT or that could be going on in a patient's life and affecting the what they're seeing you for, which I think all those things can play a role. Having a better overall understanding of anything health related. Specifically, I think like Dr. Rhonda Patrick has a ton of good stuff, ton of good research. She has her own podcast, her own website. She's on a lot of different podcasts. Dr. Peter Attia, he's another guy I really like he's been on like Jocko Willing's podcast. He has his own website where he posts articles. And a lot of these doctors are looking more at like performance and longevity type things, which again tie perfectly into physical therapy and making someone healthier, move better, live a more active life.
For sure.
The two other ones I was trying to think of were Dr. Eddie Joe. He's just a strength and conditioning.
He posts like the article reviews. Right?
Yeah, he's awesome.
Just like the infographics.
Yeah, and it's awesome. Like I don't know if he makes these. I think he does.
Yeah, he does.
And they're just like basically the results and like and everything. But he's awesome. And then of course prehab guys.
Prehab guys, sure.
Can't believe we
OGs.
Who everyone's aspiring to be.
Before
right
there
now.
were 3 PTs in a pod. Prehab.
That's
guys.
just the evolution of everyone. It's like Pokemon, you just evolve into the prehab guys. But yeah, those 3 are like my favorite because they kind of, like I said, they repost from other people too. So then you kind of just like get this gathering and from multiple domains and everything, and that's where I found Medical Talks. And going off that too, I think it's important to expand, not even just within the medical field itself, but outside. We talk about Jocko Willink all the time and Joe Rogan. I love listening to their podcast, even though it has nothing to do with physical therapy, just like sometimes just life in general. Like learning from that way. Our boy, should we drop his name? JP? Should we name drop?
We already did.
Oh, did we?
Yeah,
on the first.
Our second episode.
Okay.
Yeah, well, he'll be on eventually.
He's coming. He's on his way from Canada walking.
He's my favorite to listen to, and
he
probably doesn't know anything about physical therapy.
That's Jordan Peterson.
Jordan Peterson.
Now we have to pay him.
Those guys, again, psychology is a huge component of physical therapy, and understanding how certain injuries and problems affect someone mentally and just their overall outlook on things. And he is far and away the most.
Comes into play with our article.
Yeah, excellent. Yeah, absolutely.
That's a
nice segue for sure.
But go ahead.
Oh no, I was just gonna say I think I would agree. Out of all, I mean, I don't know that many people within the psychology realm, but Jordan Peterson is far and away the most.
Sigmund Freud, he's not one guy.
Pavlov?
The dog or something? Any other resources that you like, Chris?
So to maybe go into more of like a website based sort of discussion, I think mobilitywod.com, Kelly Starrett's stuff on MobilityWod, that's a really great resource. I would say maybe a step down from being super like technical in terms of like straight physical therapy treatment, where he's, I think, trying to hit like more of a broader audience of like how you as an individual can take care of your own stuff and do things on your own. So that's kind of a great thing, especially for giving, patients things to do on their own at home, and give you some ideas on how you might set up certain things that they can access for themselves at home. He has I think, membership thing now where it's like $10 a month to access their daily videos, but he did I think a year or two's worth of free MWOD videos that hit different areas of the body and different sort of corrective exercises and self-mobilizations that you can do for different areas, and those are all still on there. In terms of other websites, I can't really think of any. I mean, I think we covered a pretty good
as far as websites, I think one pretty good one is PubMed.
Yeah, absolutely.
So like when
we forgot about the article base. Everyone's just sending us articles.
So PubMed is a good one because, like, if, for instance, for me, if I don't know something or if I hear about something and I want to know more, usually the first thing I do is type it in Google and then follow it up with PubMed and just see what articles pop up. And I usually try to look for the most recent one, and then I'll look through that, I'll read through it. If it kind of piques my interest, I'll go through the references and see what references kind of pop up and sound good to me. And then again, I'll look up those articles and go through. And that's generally how I learn. And then if I really want to know more, maybe I'll look up a book and get the book about that topic. But usually PubMed, you can pretty much find anything about
For
anything, especially in PT. And then the problem is sometimes getting the full article,
Yeah.
which there are some ways around that you can
Dark
use the
arts.
internet.
The dark arts.
You might have to do some illegal stuff, but you can usually always get the article.
Yeah. Yeah, I think that's a pretty comprehensive list for people to at least get
Yeah.
started with. Maybe we'll have another episode down the road where we go over some others if we
Yeah,
think about more. I mean, there's tons out there. I think a big point, like you just said, most of the people we're talking about, one of the things I think we like most about them is they're almost building that into the information they're giving you. Like they're explaining where their sources come from on the information that they're bringing to
Evidence-based.
people. Exactly.
BBP.
So if you're not seeing like a guy that may have an interesting thought or idea, but he's just completely like not talking about, I got it from like these authors said this, so I sort of started to think this direction. If they have no basis in the evidence to what they're doing,
It's probably bullshit.
It's probably bullshit.
It's probably bullshit.
So work on your bullshit detector as well. You should sort of have an intuition for that as well. I mean, some guys make it pretty clear that they're snake oil salesmen.
They'll get you.
They will get you. Don't buy into it.
Alright,
So yeah,
cool.
so we will get that posted. Like I said, probably on the description of the YouTube video for this week's episode. So you guys have that, and we will get into our article review.
Yeah, so this article titled Enhanced Therapeutic Alliance Modulates Pain Intensity and Muscle Pain Sensitivity in Patients with Chronic Lower Back Pain. And this article is by 9 authors, the first of which is George Fuentes or Jorge Fuentes, I'm not really sure.
Depends what country you're in.
No, it does, because if you're like Portuguese, I think it's George, but if you're like
Is it a J?
Mexican, it's Jorge. Yeah, it's a J.
All right. You learn something new
I
every
don't
day.
know.
What's
It
his
might
last
be
name?
way off. It might be Fuentes.
I'll stat check you. What is it?
Fuentes.
Fuentes.
All right, so what this article looked at was comparing.
Might be Jorge.
Jorge, whatever. Jorge Fuentes. So this article looked at comparing groups where patients received an enhanced therapeutic alliance. So basically, the PT took their time to talk to them, how you probably should be in the clinic, and combined with E-STIM versus groups that didn't get any therapeutic alliance, and they kind of wanted to see how that would affect pain intensity.
Mm-hmm.
So there's 4 groups. One received E-STIM with limited therapeutic alliance, and then one received E-STIM with enhanced therapeutic alliance. And then there was a control group two control groups where one group received sham
wow.
E-STIM, so they didn't actually turn on the machine, and with therapeutic alliance, and one received sham E-STIM without.
Yeah.
Therapeutic
The
alliance.
other one.
Yeah,
Groups.
the other one.
And just so therapeutic alliance being things like eye contact.
So they
um,
explained it here. So it was a 30-minute session. So they just had one 30-minute session for the study. So during the first 10 minutes, each participant was questioned about his or her symptoms and lifestyle and about the cause of his or her condition. The therapeutic interaction was enhanced through verbal behaviors, including active listening. So things like repeating the patient's words, asking for clarifications, tone of voice, nonverbal behaviors, eye contact, physical touch. There you go. Enhance that therapeutic.
Eye contact.
And empathy.
That makes a good PT right there.
Yeah, saying things such as, I can understand how difficult lower back pain must be for you. So generally just being a good communicator and
Right.
understanding where the patient is coming from. If you're not, socially awkward and know how to talk to people, this is kind of be inherent. And then the other group, the patient just set them up on the, or the PT set them up on the e-stim and left the room. So they didn't really get anything besides the e-stim or lack thereof.
So they're basically a tech.
Yeah.
Yeah.
So as far as the results go, so they looked at reduction in pain. So the active e-stim, so the with limited therapeutic alliance had a 45.6% reduction in pain, while the sham with limited therapeutic alliance had a 24.5% decrease in pain. And obviously, if you're not getting e-stim or therapeutic alliance, you're not getting any much
Imagine
pain
being that
reduction.
person.
But they
Yeah.
actually did have a
They actually did.
25% reduction in pain. Then they didn't get
Placebros.
e-stim or
Placebros.
yeah.
Yep. Classic.
So then-
We always sneak that segment in.
Oh, yeah.
Well,
weren't
this is
even
why I
planning
brought
it.
this up, is because there's a big placebo component to this.
Oh, just
So-
thinking I'm at physical therapy, I'm gonna get better.
Right.
You know.
So then the active
practice.
e-stim group with enhanced therapeutic alliance had a 77.4% reduction in pain. It's pretty huge. So they did get e-stim, and then they did have therapeutic alliance. Whereas the sham e-stim with enhanced therapeutic alliance had a 54.5% decrease. So still half their
Bigger
pain
than-
was gone.
Bigger than ultrasound.
And it was more than the active e-stim with limited therapeutic alliance. So that it was almost a 10% difference between limited and active therapeutic alliance or enhanced therapeutic alliance. So again, that placebo component, just the PT talking to you and listening, enhanced your pain reduction.
Yeah.
Even more so than.
Actual
E-stim
e-stim
Without the
with
e-stim
limited.
working, yeah.
So the best group was
Therapeutic
obviously therapeutic alliance and e-stim,
With-
but
with-
technically the second best group was just the therapeutic
Yeah,
alliance.
just the
Yeah,
therapeutic
alone.
alliance, yeah.
Yeah. So go ahead.
So the
Sorry.
authors concluded that the context in which physical therapy interventions are offered has the potential to dramatically improve therapeutic effects. They continue that factors other than the specific ingredient of a treatment may have a large role in achieving positive clinical outcomes, and exploring them essential to physical therapy practice. So working to enhance your therapeutic alliance in your clinic can have a pretty dramatic effect on your patients. You know, it may not be so important what move you select or what modality you select, but how you talk to your patients, how your clinic looks even, and we kind of talked about this before, like, you know, making sure like your clinic
Equipment.
looks nice. You make
Yeah.
sure you're well dressed, and even you being fit.
Yep.
I've like harped on this before. If you're PT and you're fucking out of shape, if you're fat, you know, no offense to fat PTs, but like the word
Fucking
physical.
fat shaming over here.
The word physical is in the.
He won't be on next week's episode.
It's a jail. Alvernia jail.
Politically correct, Joe.
Yeah, put me in a safe room. But like the word physical is in the professional title. You should probably be fit.
People forget that.
And I think that's kind of like a reflection of you being able to train yourself and things like that. And like if somebody sees a really fit guy, they're gonna be like, oh, he could probably help me with my, back injury or whatever.
Right.
I think that just enhances the therapeutic alliance.
Yeah, and I would make the argument that therapeutic alliance is a skill in of itself. I mean,
Absolutely.
being able to properly communicate. I think. So we discussed this article as part of one of our classes. We went over it in class, and I can't remember if it came directly from the article or if it was just part of the discussion, but coming across as being knowledgeable and
Yeah.
understanding like what you're talking about also had a positive effect on a patient. So things like that, being able to properly communicate what you're doing and why, giving proper eye contact, having them be comfortable with you. It's very different when you come across in a relaxed, confident manner, and when you come across in being a fucking spaz
Like
and like
neurotic,
super
yeah.
like uncomfortable and nervous, like that plays a role. So I think that's a skill in and of itself, and I believe that that's something where, especially if you're thinking about us in school, that can be your way of like almost being your best skill to go into clinic
Yeah.
with. Like if you're really good with
True.
your therapeutic
So true.
alliance and patient interaction, that can almost cover up other areas where you're not as skilled
Yeah.
yet because you just don't have the reps.
So that's a really good
And
point.
Fake it till you make
Yeah,
it.
exactly.
And if it plays that big of a fucking role, like
Mhm.
Why are you not
Yeah.
work on that stuff along with working
Yeah.
on your,
Sometimes, people get better on their own. Like, it's
Yeah.
not what you do, but, like,
Right.
just you communicating with them, telling them, kind of helping them relax
Right.
and calm down can kind of enhance that, like, recovery process and make it quicker.
Yeah.
It's not necessarily your skilled stuff doesn't really matter.
Right.
It
And not
is.
that we're like necessarily competing, but there is a competitive advantage in that. I mean, how many PTs, like you said, it's pretty obvious and straightforward, and I agree that it should be.
Yes.
But how many PTs, when you go out
It's
in the
just-
it's
clinic,
probably not
are
as-
not like
it's probably not
seasoned
as obvious,
PTs
yeah.
that are terrible with therapeutic alliance?
And
And
that
if you
makes no
can walk
sense to
in
me.
as like a first, second, third year student and be better than them already at
Yeah.
that alone could maybe get you similar results with
Yeah.
some patients as they would get.
Yeah,
So-
and it's a skill that you could control yourself. Like, you might not have like the best hands-on skills or like thinking of exercises, but if you're able to, like you said, control your emotions and express that to the patient and help them control their own emotions
Sure.
and be knowledgeable in what they present with, and like the article said, like, oh, I could imagine what you're going through, like be
show
empathetic.
empathy,
Yes.
And
Active
then,
listening.
yeah,
Like,
and that's all stuff you could do like on your own before, and like just express that to them, and then
Yeah.
they'll buy in 100%. The patient cases we were doing in Musculo, which maybe we'll talk about on a podcast episode, but that was one of the things. We're almost done, and she was like, I can't believe like how much I've learned from you guys, and like you've made me so much more relaxed. Like, I thought I was going through so much more trouble than I was,
Yeah.
and you guys sat me down, you showed me the spine model and what I was going through and how to like fix myself, and it really invested myself into PT because of that. And
That's
that was like a
awesome.
huge breakthrough for not only me but my group in general. But that just happened like a couple hours ago, and we walked out with smiling faces. Even if we didn't like fix her back pain completely, we invested her into physical therapy in
Yes.
general,
Mhm.
and we taught her. At least we made a difference by
Yeah.
making her more knowledgeable about her own back pain and then functional mobility in general.
Absolutely. So as part of our musculo class on days where we have lab, the last hour is us treating actual patients from either the university community or just surrounding community that come in, and we actually treat them as like groups, so like 4 students per group with a patient, and that's what KP's talking about. So that's actual like patient treatment.
Yeah.
That's not
Yeah.
just like simulated, like,
Yeah. On each other practicing.
Right.
On your point of active listening, it's also like important to note that like this might be the first time that somebody's actually listening to these people. 'Cause,
Yeah.
like,
Did
if-
you say so?
so if they go to like a doctor's appointment, they get
Dude.
8 minutes or whatever. The doctor doesn't really like radio script for PT. Like, this might be the first time somebody's actually listening to them that actually might understand like what might be going on, and that in and of itself is like a relieving factor.
Absolutely.
It's billable. Patient education,
Yeah.
billable. Put that
Yeah.
on
Active
5
listen-
to 10 minutes.
Active listening,
Right.
one unit.
But
If they're
honestly,
not
dude,
listening.
again, that's a big point I believe in too. Like, again, so competitive advantage, like how fucking often do people on like Facebook or the internet or something, when they're talking about physical therapy as a profession, they bitch about like the lobbies of the doctors and the
Yeah.
chiropractors not being as well. Well, as strong, if a doctor only has 8 minutes with a patient and they're moving on and we have an hour, if you focus in on some of these skills where we actually have more time to like make those connections with
Yeah.
patients and get them to buy in, like that's naturally going to
Yeah.
progress the field and the
Yeah.
profession towards the levels we want it to.
People will start recognizing that.
Yeah, go out and do something about it. Like, here's the opportunity. Don't just
Provide
sit at your
good
fucking
treatment,
computer.
provide value
and-
to your patients,
Yeah.
and you'll
That's
get more
that's-
patients.
Dude,
That's
exactly. Yeah. Cool.
Did we just fix the drug problem?
Opioid.
Opioid addiction. We just fixed it.
Well, that's it.
Close the books.
So, final segment. Top 3 things we are going to buy with our first paycheck. That PT money, boy.
Yeah, relax there. I think all 3 of those go towards student loans.
Oh, dude, come on. Have a little fun.
Oh, dude, yeah, no way.
Not
no
a
way
shot?
I'm doing
You
that.
got
first.
you got to
Not a
start.
I forget what I was gonna buy. A bed, probably, first
A
off.
nice bed.
Probably like a king size.
Oh.
Sick, dude.
I'm not even like,
Sick, dude. And is that gonna fit in your parents' house?
Yeah, I live with my
Okay.
parents.
All right.
Which leads me to my second one.
New parents.
New dads. Let's go one by one because I need to think of my second one. Man.
All right. Well, I don't know if this would be like are these just 3 big purchases that we want to get eventually? So I wouldn't put this maybe within the first year or 2, but big truck guy. So nice Ford F-150.
I love it.
Country, dude.
Ford F-150.
Nice, dude.
Nice horsepower.
Little
Dude,
man syndrome, you
fucking,
know?
oh yeah. Dude, you should look at how tall I am right now.
I think, again, this wouldn't be like right after I get my first check, because then that means I would have to take time off work if I just started, but I'd go somewhere.
Okay, a trip.
I always wanted to go to Greece or Australia or one of those countries, so I'd buy a trip out there. I think that'd be
Maybe I'll come.
Nah, no thanks.
Oh, am I not invited?
No thanks, dude.
Oh, no.
Catch
thanks.
you on the next one.
Go alone.
No, probably not, but
Okay. But not with us.
but not with
Yeah,
you
okay.
guys, no.
Gotcha.
See enough of you.
All right.
Yeah, I'll probably buy a house like right off.
That
Just
PT
spend it all.
money, boy.
Just throw it away. I mean, our loans are gonna get forgiven
more
anyway.
loans
out. Oh, yeah,
dude,
dude.
100%.
Dude.
Like, why would I not? Why would I pay them off if they're just gonna get
Exactly.
forgiven anyway?
Yeah. Right.
Give me all the time in the world. I'll spend it on cars and beds and,
Yeah.
and Greece trips and Australia. I might just buy Australia. That PT money. If we just keep sending patients to PT instead of getting drugged up by opioids.
That's
man.
true.
Maybe if we
Yeah.
stop prescribing opioids, we might get more patients.
Okay. All right. Let's take a step back there, big guy.
No, but I can't wait to have a job, like go, like have a strict schedule. Like school is getting kind of tiresome.
Yeah.
I'd rather obviously be getting paid, but I want like a strict schedule. Like then on weekends and stuff, I could either go to continuing education courses eventually, but and then just like work on like like actual hobbies that I have. Like clean the yard or something, do some manly stuff.
Sure.
Mow the lawn, mulch. We just smelled some mulch before.
Just guy stuff.
Yeah,
just
guy-
outdoor guy stuff.
Snapping necks, cashing checks.
Yeah. So was that a number 2 or?
I think
Mulch?
there was one in there.
Okay, I was gonna buy mulch for a second one.
All right.
I got a bed and mulch.
Bed and mulch. All right.
Ah, it's so boring.
All right. So, I like the travel idea. I do think, experiences over material possessions have its place. Where would I go though? That's the question.
Baltimore.
Baltimore. Oh yeah.
Center City.
I don't know. I wouldn't mind getting out to California.
So you're gonna go Canada, but California's a good. San Diego's a good
Yeah,
spot.
San Diego, maybe a little wine country.
Ooh.
Just relax out in Sonoma Valley, dude.
Wow.
Maybe I'll come
Well,
with you.
yeah, dude, come along.
Since I'm not fucking invited.
Yeah, I guess just the 2
Dude,
of us
you'll be
will have
mulching
to
your
travel
yard. You
together.
don't have time. Sleeping in your bed.
Yeah, so I'm going. I'll go travel as well with number 2. Nice little California vacation.
Yeah.
Never been out west past Denver, so.
There you go. So I'm gonna steal one of yours and buy a new car because my car's a piece of shit.
What kind of car?
I don't know that one yet. I don't know. Porsche,
Porsche.
that PT money.
That PT money, boy.
No, I'd probably get something a little bit more affordable.
Good gas mileage.
Yeah.
Reliable.
Probably all-wheel drive.
I'm
Sick of the fucking snow. Sick
Yeah,
of
those
driving.
Pennsylvania winters.
Yeah.
Gotta be ready.
That'll get you.
Now you're living in California then, so you're good.
I'm not living in California.
Well, when you move there, or
I
Australia.
said I'm moving to Australia. Said I was gonna visit.
Why?
Australia would be a fucking sick trip. I might
Dude, are you
change
kidding me?
California to
They go
Australia.
to University of Queensland.
Oh,
Just learn
hang
from
out
dude,
Paul
just
Hodge, the
absorb
manual
the
therapy.
fucking PT air down there. All
Just
the
feel
manual
yourself
therapy,
becoming better
like,
at
skills,
manual.
Physio.
seeping into your pores. They all come from there.
Last one for me would be a sick podcasts room where we could just
Nice
set it up.
studio?
Yeah.
Dude.
By then we'll be like,
thinking of everyone. I like it.
Yeah.
yeah.
What if we just set up our own like podcast studio / clinic and just only treat there like
In
every
Australia.
couple in Australia, treat there like every like a week or two every couple months
Yeah.
and film podcasts there.
Fucking kangaroos in the background. For trading kangaroos.
Multiple locations in different cities.
There you go.
We just took over Australia.
Yeah.
There you go. All right, last one.
Last one. Trying to think of any other like fun stuff to get. Gonna have so much money, dude. It's gonna be like
Insane. Right?
just
Fucking
insane.
pool.
Just insane.
House at the pool,
Oh,
helicopter.
yeah.
You can just buy a bunch of instrument assisted.
Blades.
Should have every
$50,000
single
worth of fucking
Fucking
Iaston
platinum Graston.
diamond studded.
I'll go with this. I'll buy my own PT clinic. I want to own my own place one day, so
Right
I'll,
off the bat, huh?
just
Love it.
right
I like
away,
it.
dude.
Love it.
I
I'm
like it.
saying first 5 to 10 years out of school, it's happening. So
Word. All right. Yeah, what the fuck do I want? I feel like I won't have much money left after I buy the car and go on a trip.
I have one for you. Calf implants.
Oh, nice, dude. Good one.
Sheesh.
Show 'em.
We don't have to get into that. We don't have
Next
to get into
episode.
that.
Tune in.
I don't need the whole PT Facebook profile. Yeah, no, not calf implants. Maybe I'd get just some more books
Mm.
and some content to
Oh, yeah,
further
mine
my
was so boring.
further my education.
Yeah, no, absolutely.
Because right now I
Continuing
can't
ed.
afford shit. So get some
Those
members.
continuing ed classes are not cheap.
Yeah, they are not. So there you go. I'll have a continuing ed fund.
There you go. Oh, nice pen too. Could go on.
Oh,
a feather,
nice.
a feather,
Dude.
ink,
Just
Says a lot about you
million of
when
these.
you got when you
life
have
supply of legal pads.
Legal pads and nice pens says a lot about you as a professional. So, all right, that's a wrap, right?
That just about does it.
All right, thanks for tuning in, guys. Until next time, see ya.